Ever wondered what happens before a surgery? It's not just about stepping into the operating room and getting started. Indeed, the journey to a successful surgery begins way before the surgeon makes the first incision. This journey is known as the preoperative process, a crucial and meticulous pathway that ensures the best possible outcomes for patients. It's like preparing for a grand performance, where every step is rehearsed, every detail is examined, and every potential challenge is anticipated. The preoperative process involves a series of steps. It starts with a preoperative evaluation, where the patient's overall health condition is examined. It's like a detailed health checkup to ensure the patient is fit for the surgery. The patient's medical history, surgical history, family history, and lifestyle habits are all evaluated. This step is crucial in identifying any potential risks and planning for patient safety. Next comes the laboratory and ancillary testing. This phase involves various tests like blood work, imaging scans, and sometimes even specialized tests. The goal here is to get a comprehensive understanding of the patient's health and to identify any hidden issues that might complicate the surgery. It's like doing a thorough inspection of a car before a long journey. Then there are the logistics of the preoperative evaluation. This involves scheduling and coordinating various tests and consultations, ensuring the patient is well informed and all necessary preparations are made. It's like arranging all the pieces of a puzzle in the right order. Finally, there's the phase of preoperative instructions and psychological preparation. The patient is guided on what to do and what not to do before the surgery. They are also psychologically prepared for the surgery, addressing any fears or anxieties they might have. It's like a coach preparing an athlete for a big game. So buckle up as we delve into the world of the preoperative process, an essential but often overlooked aspect of surgery. Firstly, we have the preoperative evaluation, the initial step in the preoperative process. Now, what is this all about? Well, the preoperative evaluation is a crucial phase designed to assess the patient's health status and identify any potential issues that may crop up during surgery. But it doesn't stop there. This evaluation also includes preparing for post-operative care. Let's delve a little deeper into the specifics of what doctors look for in this evaluation. The physician begins by reviewing the patient's medical history. This isn't just a quick skim through the files. It's an in-depth exploration of the patient's overall health, any past surgeries, allergies, and current medications. The doctor will ask about lifestyle habits like smoking, alcohol, or drug use, as these can significantly impact surgical outcomes. The next step is a physical examination. The doctor will assess the patient's general health status, focusing on the cardiovascular and respiratory systems, as these are often most affected by anesthesia. The examination may also include an assessment of the patient's airway, as a difficult airway can present challenges during anesthetic administration. Now let's talk about something called risk stratification. This is where doctors figure out the level of surgical risk for the patient. It's a bit like detective work, where the physician pieces together information from the medical history, physical examination, and laboratory tests. The goal is to identify any potential issues that could arise during surgery and plan accordingly to minimize these risks. But the preoperative evaluation isn't just about identifying potential issues. It is also about creating a personalized plan for anesthesia. Every individual is unique, and their anesthesia should be too. The doctor will consider factors such as the patient's health status, the type of surgery, and even personal preferences when planning the anesthesia. Communication is key in this phase. The doctor will discuss the findings of the preoperative evaluation with the patient, explaining the potential risks and benefits of the planned anesthesia. This is an opportunity for the patient to ask questions and express any concerns they may have. The doctor will also provide information about what to expect during the surgical process, helping to alleviate any anxiety the patient may be feeling. Finally, the preoperative evaluation also involves planning for post-operative care. This includes pain management strategies and plans for recovery and rehabilitation. Post-operative care is an essential part of the surgical process, and planning for it in advance can significantly improve the patient's experience and outcome. So, to sum it up, the preoperative evaluation is a comprehensive process that goes beyond just checking if the patient is fit for surgery. It's about understanding the patient's unique health profile, identifying potential risks, planning personalized anesthesia, and preparing for post-operative care. It's a vital step in ensuring that the surgical process is as safe and effective as possible. Remember, the preoperative evaluation is all about making sure you're fit for surgery and minimizing any potential risks. Once your doctor has a clear picture of your health, the next step is laboratory and ancillary testing. This phase is like assembling the pieces of a jigsaw puzzle, where each test provides a crucial fragment of the overall image. It's a deep dive into your health, an exploration that gives your medical team a detailed map to navigate the complexities of your body. One of the most common types of tests is blood work. It's like a window into the inner workings of your body. Blood tests can reveal a whole host of things, from your blood type to your nutritional status, the function of your organs, and even if you have any underlying conditions that you might not be aware of. It's a fantastic tool that provides a wealth of information from just a small sample of your blood. Next up, we have electrocardiograms, or EKGs for short. These marvels of medical technology allow us to monitor the electrical activity of your heart. They can show if your heart is beating as it should, or if there are any irregularities. With this information, your anesthesiologist can better understand your heart's health and function, and this can be crucial in tailoring your anesthesia plan. And then there are chest X-rays. These provide a snapshot of the structures within your chest, such as your lungs and heart. If there's any concern about lung disease, or if you have a history of heart conditions, a chest X-ray can provide invaluable information to guide your medical team. You see, each of these tests is a piece of the puzzle, shedding light on a different aspect of your health. Each one plays its part, providing a more complete and detailed view of your overall well-being. And this, in turn, allows your medical team to tailor your anesthesia and surgical plan, maximizing safety and minimizing risks. These tests offer invaluable insights, helping your medical team prepare for any scenario in the operating room. It's all part of the careful preparation that goes into ensuring that your surgery is as safe and successful as possible. Now, let's talk about the logistics of the preoperative evaluation. The timing of the preoperative evaluation is crucial. Ideally, this assessment should be performed well in advance of the scheduled surgery. This allows ample time to address any potential issues that may arise. In fact, the best practice is to conduct the evaluation at least a week before the procedure. This timeframe facilitates any additional testing, consultations, or interventions that may be necessary based on the initial findings. But who conducts this evaluation? Well, it's a team effort. The preoperative evaluation team typically includes an anesthesiologist, a surgeon, and often a primary care physician or a specialist depending on the patient's specific medical conditions. Each team member brings a unique perspective and expertise to the process. The anesthesiologist focuses on the patient's overall health status and specific factors that may affect the anesthesia plan. They evaluate the patient's cardiovascular and respiratory systems, assess their airway, and review their medication history. The surgeon, on the other hand, assesses the patient's surgical risk and readiness. They consider factors related to the specific procedure, such as the patient's nutritional status, the presence of infection, and the patient's physical fitness. The primary care physician or specialist provides valuable input regarding the management of the patient's chronic conditions, such as diabetes or heart disease, in the perioperative period. They may suggest adjustments to the patient's regular medications or recommend further testing. The preoperative evaluation typically takes place in a preoperative clinic or the physician's office. However, in some cases, it may be conducted over the phone or through a telemedicine platform. Regardless of the setting, the aim is to gather comprehensive and accurate information about the patient's health. The results of the preoperative evaluation guide the decision-making process about the surgery. For instance, if the evaluation reveals a previously undiagnosed heart condition, the surgery may be postponed until the condition is treated. Alternatively, the anesthesia plan may be adjusted to accommodate the patient's unique health needs. In some cases, the preoperative evaluation may lead to the decision not to proceed with the surgery. This could be due to the discovery of a high-risk condition that outweighs the potential benefits of the surgery. Remember, the ultimate goal is to ensure the patient's safety and well-being. The logistics of the preoperative evaluation also involve coordinating with other healthcare providers, scheduling additional tests, and communicating effectively with the patient. These logistical aspects ensure that the patient is well prepared for the surgery and that all necessary precautions have been taken. In summary, the logistics of the preoperative evaluation involve a well-timed, team-based approach. The evaluation is conducted in a setting that allows for thorough assessment, and the results are used to make informed decisions about the surgery. All these efforts aim to ensure a safe and successful surgical experience for the patient. The logistics of the preoperative evaluation ensure that everything runs smoothly on the day of your surgery. Finally, we come to the preoperative instructions and psychological preparation. This is where the rubber meets the road, so to speak, in our journey toward ambulatory anesthesia. To begin, let's discuss the importance of clear preoperative instructions. These are vital to ensure that the patient is well prepared for the surgery. One fundamental component of these instructions is information about fasting. In general, patients are advised to fast for at least 6 to 8 hours before surgery to minimize the risk of aspiration during anesthesia. However, the exact duration can vary depending on the type of surgery and the patient's health condition. It's therefore crucial for healthcare providers to provide clear, tailored fasting instructions to each patient. Next, let's talk about medication use. Patients often have queries about which medications to continue and which ones to hold before surgery. It's essential to clarify this for each patient by considering their current medications, the type of surgery, and their overall health status. For instance, while it's usually safe to continue most chronic medications, some, like blood thinners, may need to be held or adjusted. Now, what to bring on the day of surgery? It's recommended to bring a list of current medications, a form of identification, and insurance information. But it's equally important to leave valuables at home. Let's switch gears and discuss psychological preparation. Undergoing surgery, no matter how minor, can be stressful. It's natural for patients to have fears and anxieties. Addressing these concerns is a crucial part of preoperative preparation. Healthcare providers can help alleviate these fears by explaining the procedure, anesthesia process, and potential risks in a language that the patient understands. It's also helpful to discuss what the patient can expect after the surgery, including pain management and recovery process. Encouraging patients to express their concerns and ask questions can also go a long way in reducing anxiety. In addition, techniques like deep breathing exercises, guided imagery, and progressive muscle relaxation can be beneficial. These methods are proven to reduce anxiety and promote a sense of calm. Moreover, the support of family and friends can make a significant difference. Encouraging the patient to have a support person accompany them on the day of surgery can provide emotional reassurance. Lastly, it's important to remind patients that feeling anxious is normal and that the entire healthcare team is there to ensure their safety and comfort. In conclusion, clear preoperative instructions and thorough psychological preparation are integral to a successful surgical experience. These steps help to ensure that the patient is physically and mentally ready for surgery, thereby minimizing potential complications and promoting a smooth recovery. Remember, every patient's journey is unique, and individualized care is the key to a positive surgical experience. Proper preparation, both physically and mentally, sets the stage for a successful surgical outcome. To wrap things up, let's quickly summarize what we've learned. The preoperative process is a critical component of ambulatory anesthesia, setting the stage for a successful surgical journey. It starts with an in-depth preoperative evaluation, where the patient's medical history, current health status, and any potential risk factors are thoroughly assessed. This evaluation is not just a box-ticking exercise. It's a detailed examination that enables the medical team to plan the safest and most effective anesthesia strategy tailored to the patient's needs. Following the evaluation, we have the laboratory and ancillary testing. These tests provide a comprehensive picture of the patient's health. They can range from blood tests and imaging studies to specialized assessments depending on the patient's condition and the type of surgery planned. The results of these tests provide invaluable data, allowing the medical team to make informed decisions about anesthesia management. Next, we dove into the logistics of the preoperative evaluation. This involves coordinating various elements such as scheduling appointments, managing resources, and communicating with different healthcare professionals. It's a behind-the-scenes operation that requires meticulous planning and teamwork to ensure that everything runs smoothly. And of course, we can't forget about the preoperative instructions and psychological preparation. Patients are given clear guidelines about what they need to do before surgery, such as fasting guidelines and medication instructions. Equally important is the psychological preparation, helping patients understand what to expect during and after surgery, which can significantly reduce anxiety and contribute to a better overall experience. Every step in this process plays a vital role in ensuring the patient's safety, comfort, and the overall success of the surgery. Each element is interconnected, contributing to a well-orchestrated preoperative dance that prepares both the patient and the medical team for the procedure. Remember, the preoperative process ensures that you're in the best possible condition for surgery and that your medical team is fully prepared for the procedure. It's a vital part of the journey towards a successful surgical outcome.